Welcome to Pulse&Pressors, where critical care gets crystal clear. Today, we're talking about inotropes, drugs that help the heart squeeze harder when it can't keep up. An inotrope is a medication that changes the force of cardiac contraction. When we talk about positive inotropes, we mean drugs that strengthen contractility, increasing stroke volume and cardiac output. A negative inotrope decreases the force of cardiac contractions. Examples would be beta blockers and calcium channel blockers. They're crucial in managing shock and acute heart failure, especially when the heart needs temporary mechanical help. Most inotropes act by increasing intracellular calcium within cardiac muscle cells. They either stimulate beta-1 adrenergic receptors, which raise cyclic AMP levels, or they inhibit phosphodiesterase type 3, preventing CAMP breakdown. In both cases, calcium floods the myocytes, and each beat becomes stronger. The main inotropes used in critical care are dopamine, dobutamine, Milrinone, and digoxin. Dopamine acts on D1, beta-1, and alpha-1 receptors, with dose-dependent effects. Dobutamine primarily stimulates beta-1 receptors, offering clean inotropy with mild vasodilation. Milrinone is a phosphodiesterase 3 or PDE3 inhibitor, enhancing contractility and causing vasodilation without directly stimulating adrenergic receptors. Digoxin is a cardiac glycoside medication that acts as a positive inotrope, meaning it increases the force of the heart's contraction by inhibiting the sodium-potassium ATPase pump, which ultimately raises the intracellular calcium available for muscle contraction. Inotropes are often used in acute decompensated heart failure, especially in reduced ejection fraction or in cardiogenic shock. But they're not benign. They increase oxygen demand, can cause arrhythmias, and long-term use is linked to increased mortality. That's why they're typically reserved for short-term stabilization or as a bridge to mechanical support or transplant. In the next 4 videos, we'll dive deeper into each inotrope: dopamine, dobutamine, milrinone, and digoxin, exploring their unique receptor profiles, clinical uses, and pitfalls. This is Pulse&Pressors, providing a daily education on the marvels of the human body.